So the benefit, of course, is it's a one and done procedure. Unless someone regains 15 pounds or ages 15 years, this is lasting jawline definition.
Correct. It is safe, proven, and effective.
And we were one of the first to have it here in Northern Colorado. And we've performed over 100 of these procedures and are very happy with our results. Hello, I'm Dr. John Bender.
And I'm Shay Copelin.
And we're broadcasting to you live for What's Up Doc, another exciting segment where today we're going to be speaking about minimally invasive facelifts. So we work with a company called INMODE, and they have created the Ignite platform. This is the latest generation of minimally invasive skin tightening. So with traditional facelifts, the plastic surgeon is going to make incisions either here or here. They're going to stretch skin back. They're going to remove some skin, and it's going to take a little while for someone to look like themselves again, but they're going to have really good results, and this is still the gold standard. There are alternatives, though, and so sometimes people don't want to pay $20,000 or $30,000 for a procedure. They're looking for something that might cost under $10,000 or sometimes under $5,000. They want something that's going to have a faster recovery, and maybe they don't need as much skin tightening because they don't have as much laxity, for example. Let's go through some cases, and we'll talk about what we're offering here at Miramont. So Shay and I are part of a surgical team that offers the FaceTite Turbo and the Quantum 10. These are two different methods we have for tightening skin. It is a surgical procedure. I typically make small little incisions in front of the ear or down on the chin or under the chin, which heal beautifully. You'll never find these incisions a year later. And it allows us to access for doing two things. One is liposuction if needed, but also for what is called RFAL, radiofrequency-assisted lipocoagulation. This is where we use heat energy, and I believe we have a couple tools here. This would be the FaceTite Turbo, and this would be the Quantum. And basically, these tips are heating up to anywhere from 70 to 100 degrees Celsius. And we're using heat energy to create what's called a contraction of the fibroseptal network. Let's take a look at some cases that we've done here at Miramont. So the first is Ashley. Ashley's a younger woman. She's in her 30s. And she had some what we call adiposity, or increased adipose tissue underneath the chin, the submental area, and wanted that to be gone. So we did a minimally invasive liposuction, and we did some skin tightening. And you can see her pre-op photo and her image at 1 month and at 3 months. And the result is very good. We were happy with it. She was happy with it. She was back to work, did it on Friday, back to work on a Monday. And you can see that most of her improvement is there by the first month, but it takes about 3 months to 6 months to get that full contraction. Now we'll take a look at Shay, who's here with us. So Shay had the procedure, and this was with the next generation with the FaceTite Turbo. So a little hotter tool, a little faster tool. And her results actually came in quite a bit sooner. You can see her result at 3 months is pretty impressive. Shay, what do you remember your procedure?
It was easy. I think I slept for a little bit of it. It kind of just drone out in the room, which is kind of nice, but I'm loving it.
Yeah, it turned out really well. And your scars are not visible. I mean, no. If you take a look here and here, I mean, there's not anything that you can see. She did come to work the next day, which I don't recommend. She did fine, but
okay.
And you drove yourself home after the procedure? Yeah,
yes,
so people, sometimes I'll have a driver, but it's not really necessary. We do these under a little bit of nitrous oxide, maybe some Toradol, hydroxyzine, but there's nothing that would impair judgment, reflex, or coordination. And people are comfortable during the procedure. We've had folks actually fall asleep sometimes because it's kind of warm and it takes a couple hours. Next, let's look at someone at the prime of their life in their 50s. This is Teresa. Now, her situation, she does have some extra adipose tissue in the submentum, much like Ashley, but she also, because she is now middle-aged, we're starting to see some creases in the neckline. So if you look at that oblique before and after, and then her lateral before and after, you can see we dealt with the submental laxity, both the fatty tissue that was liposuctioned as well as tightening the skin, but we also saw some contraction of those neck creases, which was pretty impressive. And she had an outstanding result. Next, we're going to look at Jodi. Jodi is also in her 50s, but she has some pesky platysmal banding. Platysmal bands are these little bands that stick out when men shave, and tighten their neck to shave. It's this muscle here. And because it's muscle, we can't liposuction out. We can't necessarily tighten skin tight enough to make the muscle not push through the skin. So for Jodi, we also, in addition to doing the RFAL or radiofrequency-assisted procedure, we use the Quantum 10. It's a little hotter to get that skin a little tighter. She didn't really need liposuction. And then we also placed what's called a thread, a PDO thread. This is an absorbable thread. You might ask, well, absorbable, it's not permanent. But the idea here is this is going to run underneath the neckline, just a little bit above the hyoid bone. We attach it back to the mastoid process here. And what happens is all the heat energy from the Ignite tool tightens the skin such that by the time the thread disappears, we now have a tighter contraction than we would have without the thread originally. Dr. Mulholland talks about the grilled cheese model. So the grilled cheese model is where you have the grilled cheese is hot and gooey. You can slide the bread one slice over the other. And then when the cheese comes to room temperature, the bread is stuck. In a similar manner, the thread is making it tighter than it would have been otherwise. But as the heat energy produces that tightening, and as the person deposits collagen over the next 3 to 6 months, they get a tighter result. We also can sometimes put a little Botox into the platysmal bands as well. We should chat a little bit about the risks and benefits. So the benefit, of course, is it's a one and done procedure. Unless someone regains 15 pounds or ages 15 years, this is lasting jawline definition.
Correct. It is safe, proven, and effective.
Yes, and there have been many studies. The original technology came out of Israel, and it was pioneered further in North America, and we were one of the first to have it here in northern Colorado. And we've performed over 100 of these procedures and are very happy with our results. Very low complication rates. And most, like tiny burn or bruise, is going to resolve typically within 6 weeks or so. Some people will get a little bit of numbness that can persist up to 6 months. And if we have to really work what I call the marionette line, we can get some marginal mandibular nerve drop that will sometimes leave a little droop. It's temporary. We're not cutting the nerve. Think of it like it got tased. And so once that stunned nerve recovers, I think the person that took the longest was Mrs. Bender, and that was 6 months. But most people, they recover at the 12-week mark. Finally, included with every face tightening procedure here at Miramont, we include the Morpheus 8. So welcome, Jodi. We're hoping that you could tell us a little bit about the Morpheus 8.
Morpheus is basically microneedling kind of on steroids. It's microneedling with radio frequency. It's going to go into the skin. It's going to cause trauma, and the body goes, oh no, there's trauma in the body. I want to make more collagen and elastin, which creates tightening. It's amazing that we have so many wonderful results from it.
There's many things we do at Miramont to create what we call the comfort Morpheus. We may administer a little bit of Toradol. We can also do some Mesoram, and we give people nitrous oxide. And the procedure is reasonably well tolerated and gives fabulous results.
Indeed, yes.
Now, how often would someone need to repeat the Morpheus?
We encourage 3 to 4 at least with the face or the body tight. And we encourage to do at least minimum 2 to 3. That will create the best result.
So with the skin tightening, again, this is one and done. Typically, we don't have to repeat this procedure maybe for another decade, unless someone regained 30 pounds or aged 15 years. But with the Morpheus, that procedure, they're going to have their best results with a couple repeated. And these are usually done how far apart?
Typically 4 to 6 weeks.
4 to 6 weeks. So that would be done 4 to 6 weeks after their initial procedure and then again after that.
Correct.
Outstanding. Well, Jodi, thanks for joining us. We enjoyed hearing
pleasure.
about the Morpheus.
Yes.
Well, that's all we have time for today. We'll see you next time. I'm Dr. John Bender.
I'm Shay Copelin.
I'm Jodi Watson.
And farewell from Miramont Wellness Centers.